My research has found that when people believe that their emotions can change and that they can have personal control over their emotions, that they're more likely to use more active and healthy emotion regulation or kind of coping strategies to cope with stress and negative emotions. And they also show lower levels of things like depression and anxiety and binge drinking. And I think there are some parallels with my research and what clinical psychologists are studying to try to clarify the relationship between trauma exposure and something like PTSD. So, similar to stress, trauma exposure is surprisingly high during the lifetime. So, there's some estimates that on a population level, about 70 or 80% will experience something that would qualify as a trauma in their lifetimes. And yet, the vast majority of those people do not go on to then develop PTSD. And so something that clinical psychologists are really interested in are their cognitive styles or kind of ways of thinking after a trauma exposure that can put someone more or less at risk for developing this more prolonged trauma response and or PTSD.
So I think that one of the interesting things that's been found in research is that something that seems to promote resilience in trauma is the presence of social support. So people who have close relationships, whether that be friends or families, tend to be less likely to develop secondary diagnoses in the context of trauma, things like PTSD. They're less likely to engage in some of these more maladaptive ways of coping, things like using substances to escape or avoid, self-harming behaviors, or social withdrawal. And so I think what also tends to promote resiliency is when people feel they have a place in which they can, at their own pace and in their own way, process and work through what's happened to them. And given how hard trauma is, it may very well be that that kind of resilience is going to be fostered best in the context of a therapeutic relationship where a person's working with a therapist to be able to engage and think through what's happened to them. But through that processing and engagement and remembering, people also work on some of the assumptions that they've developed related to the trauma, which often can include blaming themselves for what happened, some assumptions about how dangerous the world is or how dangerous other people are, or how likely events like this are to happen. And that kind of processing of a person's assumptions about the event can be really critical in helping a person move past the event, to live with the event, and to not let it rule their life.